Hi, my name is Casey and I'm a registered dietitian with URS Medical, and today I'll be showing you how to use a Farrell bag when feeding your child through their feeding tube. The Farrell bag attaches to your child's feeding tube and allows extra air to escape out of the stomach during the feeding. To get started, always make sure you wash your hands and you have a clean working space. You'll need your Farrell bag, your feeding bag, and your feeding pump. The Farrell bag can be used to feed through G-tubes, GJ tubes, and NG tubes, never used to vent through the small intestine. Hang your Farrell bag so it's higher than your feeding pump. To prime using a Farrell bag, remove the cap from the end of the Farrell bag tubing. Find the white roller clamp at the top of the Farrell bag tubing and close it. Prime the pump till the formula gets all the way to the end of the tubing. Close the blue clamp at the end of the Farrell bag tubing when you're finished priming. Attach your Farrell bag tubing to the end of your feeding tube and start your feeding. Once you have established flow, go ahead and open the white roller clamp. Some patients on very low rates, like neonates, might require a longer period of time before opening the white roller clamp. Some things to note during the feeding: make sure the Y port is at or below your child's stomach, and the Farrell bag is also hanging higher than their stomach and the feeding pump. Make sure to change your Farrell bag out every 24 hours. This is usually the same time you're changing your feeding bag out. When the Farrell bag is working properly, it's normal for the formula to flow up and down the tubing below the Farrell bag. If formula starts to back up into the Farrell bag, check your tubing for an occlusion. If there's a large volume of formula in the Farrell bag after resolving a clog, lower the Farrell bag height to prevent a free flow bolus going into the patient. In conclusion, that's how you use a Farrell bag when feeding your child through a feeding tube. For any further questions, please reach out to your local URS Medical representative. Thank you for your time.